Very warm welcome to all of our attendees this morning. So we've been chatting a little bit about training, employers' responsibilities, victimization in and around the workplace, as well as hazardous substances, in specific cement, and what we are working with when it comes to the Lafarge cement for many of us working out there. But to end off this month, we are looking at personal protective equipment. And because we live in COVID-19 situations, a few questions came about on the correct use and do's and don'ts of the PPE that you are wearing for COVID-19. So we're going to take a look at a little bit of that and then round off as well about the full responsibilities of each one of us, whether an employee or an employer, on how we should be looking after our PPE. So even though PPE seems to be less important than all other safety measures, it is still vital. We go through the entire process of ensuring all the hazards are identified. We take a look at the risks that are associated with these hazards, and then we put protective measures in place to ensure that we have either eliminated the hazard completely, put in some sort of engineering control to stop a human person from contacting that hazard, such as social distancing. In other words, you cannot get close enough to it in order to be hurt. Then we put in other measures that allow you to work within the hazard, but protect you against a direct influence of that hazard. And then we come down to things like training. While working in that hazardous environment, we give you the training, knowledge, and skills to know, see, and understand what could go wrong. Now, every single day, PPE plays a very important role in what we do as plumbers, but it is the last defense against risks. And as such, it is still extremely important. We can think of maybe a soccer match where the players obviously do not want to be on their half of the field. They always want to be on the defending team's half. They always want to be trying to be as close as possible to scoring those goals. But when it does happen that the defending team comes against us and is in our half, well, the goalie is obviously that last defense. And so you've done all you can as a team up to that stage, and then PPE plays a vital role in preventing risks and hazards from affecting you. Now, we never want this to happen. We never want to only rely on PPE to stop hazards and risks from affecting us. So PPE has proven to be a great source of personal protection. That is why it is so mandatory when we get to a site. The first thing they look for is your personal protective equipment. But don't make it seem as if that's the only thing we look for. Remember, we want to make sure that we have it, but also that it is used properly and maintained safely so that it is actually effective when we put these types of PPE on. So from hard hats to overalls to reflective vests, right down to gloves and respirators, to the gum boots or safety boots that we wear, all of these have been designed specifically to assist you in ensuring that you are kept protected from these risks and hazards. So perhaps ask yourself a question. Do you care for the items that are given to you in the interest of health and safety? Now, this is a topic for discussion for most people. In fact, a question that came out from you, that question was, who is responsible for caring for that PPE that is given me? And yes, we know, according to your general safety regulations, as well as the Occupational Health and Safety Act, no person, an employee, should have to pay for their personal protective equipment. It should be given free of charge from the employer, the owner of the business. So if you work for that company, you should be given PPE. But then employers ask the question, well, how often should we be issuing PPE? And who is responsible for looking after PPE? Well, that is why there are disciplinary measures if you are not taking care of that PPE, it can become a very costly endeavor for the company to continue to buy you PPE, even though it is free of charge. But there is going to get to a point where there is responsibility placed on each individual. So the question that you have as employees, do you regularly maintain the PPE that you have and keep it in good order? Not only does it last longer, bringing down the total overheads of constantly paying for PPE, but it also helps to keep you safer for longer. So let us now take a look then at COVID PPE. And two questions came through. One of the questions was on the gloves that we should be wearing. How should we be wearing it, and what should we do when wearing gloves? And the other one was on masks. So here are a few do's and don'ts on the gloves that you are currently wearing and what you should do against what you should not do. So very important. If you are going to wear gloves, and many of you are wearing this specifically, not just in your day-to-day routines, going to the shops and back, which some are actually making use of because they are touching items as they're going around. We want to remind that most of you are actually wearing this when getting to your private clients. So your residential clients, you're going into their homes to assist them with their plumbing work, and you are using the different types of gloves that you find out there. Most importantly, the type of glove that you use is also important. So we want to mention that your nitrile gloves are very, very good. They do help you. You can get the latex ones, but if you have a problem with the latex hurting your skin, you can get the nitrile gloves in big boxes so that you can constantly reuse them. So the very first thing we want to mention is to please wash your hands before putting on your gloves. Now, if you're not near a sink or to wash your hands with soap and water, the government regulates that you should be using hand sanitizer. In this instance, we also want to remind you of some of the dangers. Hand sanitizer, obviously, because it has a large amount of alcohol in it, we've seen the videos of many hurting themselves because of the hand sanitizer that they are using. So be very cautious when just looking at hand sanitizer as your first line. If at all possible, get to clean running water using soap. There are other sanitizers out there that do not contain alcohol, and obviously we try and give you out there the best information possible. So we have found some brilliant products with some other companies that give you, as an IOPSA member as well as a SIOSH member, discounts on these products, whether it is sanitizer, disinfectant, or even home fogging or car fogging or misting, that type of thing. Please remember we do have that information for you. And this is all in the interest of looking at the long-term exposure to the type of chemicals that we are constantly faced with day to day. Another very important do is to remove your gloves after your activity. But now we need to know how we should remove them. You see, we don't want to remove them with bare hands. So when you have the glove, you've always got that little piece on the wrist that generally stays pretty clean on the inside of your hand. And you can touch glove to glove and then fold them inside each other without having to touch the outside of the glove with your bare hands. You should also not wear these from place to place. So obviously you're going from one residential house to another residential house and you're driving with it in your car and you're touching everything. Now, what you are essentially doing is having the possibility of cross-contamination. And you can think of this even pre-COVID, sorry, before we've had COVID, you could be working on a drain system, on a sewage pipe. And now you're dealing with other hazardous biological agents there. You don't want to touch that and then spread it to your vehicle, to your clothes, to your tools, or perhaps to the next job. So with COVID being such an important factor that plays a part in how we manage our health and safety, we want to take a lesson from the cross-contamination from the use of gloves as well. So please, They should be put on before entering, whether it's a store or a house, and then removed upon exit. Hands should be cleaned after removing the gloves. Again, if you're going to use hand sanitizer, fine, but if possible, please wash your hands with soap and water. Then always avoid touching your face or cell phone when wearing gloves. And we've seen this very often. Perhaps you're working at a house and you need to take a call. You take it out with your gloves on, you use your cell phone, you put it back in your pocket. You take your gloves off, you wash your hands, but now your cell phone has been exposed to whatever was on your gloves. So just something to think about. We often touch our faces even without thinking about it. And if you really sit and watch someone, another person, it doesn't have to be yourself, watch them throughout their day-to-day going about, you will notice how often people actually touch their faces. So please be very cautious of this, as you can spread germs very quickly in and around your own body. Then don'ts, two don'ts. Don't drive around in your car with your gloves on. Again, you are just doing cross-contamination. So wearing gloves from the outside of the car to the inside can obviously spread germs inside the vehicle. If you are concerned about your car, just get a pack of disinfectant wipes to clean your steering wheel and other instrument panels while you are driving around. Perhaps you can do this while washing your hands as well. Now, again, we've got the products for you. You get good discounted rates of these products because you're an IOPSA or SIOSH member. So please get in touch with us if you want more information. We want to keep you safe from the start, right from your home to your car to your work, so that we prevent cross-contamination. Then don't use your bare hands to remove your gloves. If you've properly removed gloves, then they should be inside out and disposed of immediately. Please don't put it in your car, in the side panels, in the middle control panel, in your pockets or in your purse. We do not want you then to cross-contaminate that as well. Even though it has been removed correctly, you still have that possibility. So please rather just dispose of them as soon as you can. This is obviously, of course, dependent on the type of glove you are using. If you do have gloves that can be used often, then ensure you wash your gloves and have the correct procedure for washing your gloves or PPE before moving on to the next task. Then the final one is on masks. Final because it's about COVID. Many of us have to use masks. There are some funky designs out there, and we want you to smile when wearing a mask, because many of us have a problem with the mask. We don't really want to wear them. We get sick and tired of wearing a mask, but it is there for our protection. So when wearing a mask, make sure you use a cloth mask that covers your nose and mouth snugly. The material that you choose should be sturdy but breathable. Then ensure that you wash your mask regularly. Machine washing is sufficient, but please wash that mask as directed by the manufacturer. Wash your hands immediately after removing your mask. Remember to avoid touching your face and eyes. Now, we've seen it, and maybe it's just because we're getting used to wearing masks. We're constantly adjusting our mask, taking it off, putting it back on. We walk around in a shopping center or at a private home. Just before we get into the car, we remove it. Where are you putting that mask down? Are you putting it down face down, upside down? Is it going into a protective cover in order to protect that mask? So just think to yourself, where is the mask going and what am I going to be breathing in later on? What can you do to protect yourself to the maximum degree? Yes, there's always those unforeseen conditions, but if we can do as much as possible to protect ourselves and others, it will go a long way in preventing cross-contamination and getting ourselves back to a normal routine. Then please don't purchase or hoard N95 or N100 or other approved surgical masks. If there is a possibility, try and get yourself a different suitable mask for the work that you're doing. If you have to use the N95 or N100, fine, but please don't hoard these because they are for healthcare professionals and it is in short supply. We've seen it being in SA, we know what is actually happening. PPE is in very short supply for those who are actually caring for our loved ones who are sick and in hospital, not just due to COVID, but other illnesses as well. And if they don't have the proper protection, they cannot protect themselves or those who are in the hospitals. Then please don't use a mask as substitutes for social distancing or staying home. If you can, make sure that you stay at home and only go out for essential things. Business is essential, going to the shops is essential, but really maybe take a look at your lifestyle. Have you gone back to normal? It's now level 1. Is it life as normal? Well, COVID hasn't changed. Just because we've changed the level of lockdown does not mean that the danger still does not exist. Please continue social distancing, staying home wherever you can. And if you must go out, wear a cloth mask while performing your essential tasks. So if you're going grocery shopping or going to the pharmacy, please ensure you wear your mask at all times. Then, if you have a child under 2 years of age, or if you have trouble breathing, maybe due to asthma, don't wear the mask, but then you're also not allowed to go out into public. So rather consult a doctor to see what is the best method for you as somebody who battles to breathe, or for your infant child, to ensure that they are not exposed to the danger of not being able to breathe properly, or potentially the danger of exposure to outside biological hazards. So that's all for the COVID side. We just want to find out, do you have a PPE program? And this is for a complete PPE program, from hard hats to gloves, respirators, goggles, shoes, overalls. Are you protected? Do you have a proper program in place? And have you included your COVID-19 PPE into that? Remember, your program should allow for assessing the workplace for hazards. So you need to have a risk-based thinking. We need to, first of all, use engineering and work practice control measures to eliminate or reduce the hazard before resorting to PPE. But PPE should be mandatory. Then select appropriate PPE. So don't just go down to the shop and check out what it is you feel should be the right thing. Get advice, find out the type of work you're doing, and research to see if you have the appropriate PPE. I know last time when I spoke to the guys at Pienaar Brothers, phoned them up, they gave me advice on what to use. So don't forget, when you go to these shops or the PPE stores, ask the professionals for their assistance as well. Then inform your employees why the PPE is necessary. There's no use just giving someone PPE without them understanding the reason why they should be wearing it. Train employees how to use the PPE and how to care for their PPE. Now, all too often we say, well, you should know. Yes, sometimes it is common knowledge and people should know. But we are not children. We are adults. We want to be treated with dignity and respect. And if there's something we don't know, we want to have the freedom to be able to approach a person and ask them what we should be doing. But at the same time, as employers, you should also have the freedom and understanding that not everyone knows what you know, and not all of us are in the same boat when it comes to education on PPE. So if you know it, ensure you train your staff. And if you've trained them before, train them again. There's no such thing anywhere that a reminder is a bad thing. So do you know how to use it? And do you know how to clean and care for your PPE in order to recognize deterioration and failure of that PPE? And then please ensure that you have some sort of documented policy that requires employees to wear selected PPE. We cannot use the old saying, you should know. You should know that you must wear your PPE. You should know you must wear your goggles. No, we are mandated to put signs up in order to remind you to wear a mask before coming into a shopping center. So because we have that sign, it's the same when working at any environment. There should be a sign to tell us. Now, what if you get to a private household? You're working with a drill, and the drill is going into concrete, so you're using a masonry bit. There's going to be dust. Is there a sign on that wall to say that you should be using a mask? No. That sign will be in the training manual where you trained your employees on how to use and care for their PPE. And the more we do that, like these toolbox talks, we get reminded on what should be essential when performing our tasks. So lastly, what are your responsibilities? Are you an employer? Are you an employee? Well, here are your responsibilities. As employers, you must assess the workplace for hazards. You must perform a risk assessment. You must provide PPE. You must also determine when to use that PPE. And you must also provide PPE training for employees and instruction in the proper use of that PPE. What about you as employees? Very simple. You must use your PPE in accordance with the training that you received and any other instructions received about PPE, which most often you should find in the risk assessment. And you must inspect daily and maintain in a clean and reliable condition the PPE that you have received. These are your responsibilities according to the law. So please, it's not a session to come down on you, to say that you're doing something wrong. It should be a positive message to each one of you out there that you are doing well up to now. We want to continue in the same course, continue in the same safety system that you're providing, in the same risk-based thinking. Keep ensuring that you are safe for yourself as well as safe for those around you that may be exposed to the work you perform. So thank you very much for joining us this morning. We're looking forward to October's Toolbox Talks. The first one we're going to discuss next week is a hazardous environment, that of noisy areas. So noise-induced hearing loss regulations come into play, protecting your feet and how we should do that with the correct type of PPE, and then ergonomics, the hot topic in the health and safety industry at the moment, aside from your hazardous biological agents regulations, but the new ergonomics regulations that have just recently come out tell us specifically what we should be doing. And then there's a few gray areas, and we would like to give you a few suggestions on how to protect yourself from this ergonomic hazard. And then we'll wrap up with the responsibilities of employees. What should you be doing in terms of the law? So once again, thank you very much for joining us.